All right, thank you. Max, it was great to be able to follow your talk because you asked for more integration with psychotherapy research, and now we got an affect-focused dynamic therapy thoughts on the matter. And also the topic of psychedelic use by therapists came up, and I will also be exploring that a bit. And so, yeah. So this has been written about a lot and spoken about quite a lot. So usually a common argument in favor of this is that experience with psychedelics can make it easier for therapists to relate with their patients in that very specific altered state of consciousness, and that they can use this as self-disclosure to build rapport and alliance. If you survey patients about this, most do show like a preference towards having a therapist with their own experiences. Some training programs actually encourage their psychedelic therapist trainees to have their own experience, such as MAPS. But this might, of course, be ethically and legally problematic. So some instead promote non-psychedelic altered states of consciousness as a training for therapists. But nevertheless, we know that this practice is quite common. In a recent study of psilocybin study therapists, 28 out of 32 had tried psilocybin. So no matter if it's good or not, it's probably happening. Maybe we have some guilty people in this room. So I feel it's quite important to investigate the effects that this use might have on therapists, and also perhaps their outcomes. So we know from psychotherapy research that the outcomes of psychotherapy is partially dependent upon personal characteristics of therapists apart from their therapeutic modality or experience. So probably personality, skills, other variables. Around 5 to 10% of therapy outcomes are dependent upon such factors. And while it's difficult to research this, probably it's factors that have to do with building alliance and working relationship, such as trustworthiness, empathy, and emotional attunement. And part of this is also probably the capacity of therapists to handle a variety of different situations that give rise to strong emotions. Because that's part of therapy. And so within psychodynamic therapy, we have this concept known as countertransference, where the therapist tries to pay attention to their own emotional reactions within therapy, and they use it to guide interventions and understand the patient. And so the countertransference is both dependent upon certain signals sent from the patient, but it is also influenced by the therapist's own bias and their own history and their own relational priors. So according to attachment theory, our relational histories shape the expectations we have of others, in particular how they handle us in emotionally valent states and when we are in need. So how these expectations kind of collate is referred to as inner working models within attachment theory. And so within attachment theory in clinical psychology, we believe that more secure attachment makes it easier to establish emotionally close relationships with a wide variety of people, because we will be less burdened with negative expectations and projections accompanied with anxiety and avoidant behavior. And also, greater attachment security has been shown to correlate with an increased capability of emotional regulation. So this indicates that the processes of emotional regulation and attachment might be causally interrelated in some way. And in a recent paper, my colleagues from Stockholm University argued for the importance of attachment security as a predictor of psychedelic experiences and as a potential target outcome of psychedelic therapy. And if this is true, increased attachment security from psychedelics might also be accompanied by greater access to and ability to handle one's emotions, along with an increased capability to form close relationships with others. And from there it follows that psychedelics could serve as a useful method in improving some personal characteristics relationships with patients in therapists. And so this might be true both for psychedelic and non-psychedelic psychotherapists, given that therapist effects are probably equally important within all modalities. So then, evidence for that could serve as some additional arguments for using psychedelics in the training of therapists in general, not just psychedelic therapists. So I will not be able to provide any clear answers to this today, but I hope to inspire maybe some further inquiry on this matter. So, yes. So in my thesis project for my master's in clinical psychology, I studied psilocybin retreat attendees, legal psilocybin retreats, led by Swedish psychologist facilitators. And while this is not a therapy program, it does contain preparation and integration in groups. So it's in ways quite similar to psychedelic therapy. And the retreats take place over 4 days, and there are 2 high-dose psilocybin truffle experiences. And due to a collaboration with a retreat company, all participants are offered the choice to participate in our research. And data collection is still ongoing, and hopefully we will publish within a year or so. And we're mainly focusing on attachment, but we're also administering several other measures. And some of their programs are specifically organized for professional development of healthcare professionals and therapists. So apart from studying attachment changes, I also qualitatively investigated the experiences of therapists in one of these retreats. Specifically ISTDP therapists. So I will give a super brief introduction to intensive short-term dynamic psychotherapy. So it's a short-term affect-focused psychotherapy model based on psychoanalysis. And while it uses psychoanalytic concepts of conflict and transference, it is more structured and uses more like active interventions. And yeah. So through defense work, it attempts to facilitate emotional breakthroughs by like raising the patient's resistance and level of emotional conflict within the transference. The theory says that if the patient is allowed to fully experience their emotions in these moments, then they can get some insight into the causes of their symptoms and then relief from those. And just like in psychedelic therapy, these emotional breakthroughs have been shown to correlate with the outcome results of the therapy. But this is like a very demanding and quite almost aggressive technique. It's difficult to learn, and it puts strain on the therapist's own emotional capacity. And probably it also, much like psychedelic therapy, because it's so powerful and dramatic and promises rapid symptom relief, it might lend itself to inflated expectations and feelings of omnipotence in the therapists. So because of some of these commonalities, I decided to focus specifically on these therapists in my thesis. So I did 2 studies for my thesis. In the first one, it was a longitudinal quantitative survey of 50 attendees. I wanted to see whether there were improvements in attachment security, emotional regulation skills, and whether these changes were predicted by emotional breakthrough, like in affect-focused therapy. And in the second study, I wanted to see whether therapists having gone to these retreats could relate their own experience of ISTDP to the psychedelic experience in any way, and also if they noticed any meaningful clinical changes in their own work. And so in the first study, there was a sample of 50, as I said, about half female, most middle-aged, mostly psychedelic naive, and there were increases in emotional regulation skills after the retreat, so a Cohen's D of 0.54 and some moderate increases in attachment security. So these measures are, ECR is a measure of attachment insecurity. So but the insecurity would indicate more secure attachment. And while changes in emotional regulation skills were predicted by emotional breakthrough, it was basically equally predicted by mystical experience. Interestingly, these measures did not predict the changes in attachment. Might be because the effects are smaller and because of the sample. And yeah. And also, higher attachment anxiety at baseline was correlated with higher degrees of mystical experiences, which is interesting. This is in line with some prior research on attachment and spirituality. So for people with more disorganized attachment, like naturalistic spiritual experiences and religious conversions are more common. So this could be the case, could be an explanation of this finding. And so in my second study, yes, so I wanted to talk to these therapists, but I couldn't, so I had them write some essays instead for confidentiality reasons. So in the first, I asked them to write 2 short essays. In the first one, I wanted to see if they could relate their experience in some way to their own views as therapists. And in the second one, I wanted to probe for some examples of clinically meaningful changes. So for the first set of questions, these are the themes that I could isolate based on thematic analysis. So the first one was basically several different commonalities between ISTDP and psychedelics. They both elicit access to the unconscious through altered states of consciousness. And they also saw some insight into theoretical limitations of ISTDP. So basically, while they could see commonalities, they saw that ISTDP was limited in some ways that couldn't account for their psychedelic experiences. And while I specifically asked for that in the other question, they also offered some examples on how they would want to change their work after having undergone this powerful experience. So I have some quotes. In ISTDP, there is the concept of the unconscious therapeutic alliance. In psychedelic therapy, there is the inner healing intelligence. During my psychedelic therapy sessions, I very strongly and directly experienced a powerful drive to persevere, overcome resistance, and face painful memories and feelings. This was active within me even during the most turbulent cognitive, perceptual, and emotional, like the inner healing intelligence at work. I believe it is the same thing as the unconscious therapeutic alliance. And as a result of my psychedelic experience, I believe I have a more experiential understanding of this ISTDP concept. And there's a clear relationship between the perspectives. My view on the ISTDP metapsychology has not changed, but I have seen several places where it is in need for an update. For example, I see the need for a fourth corner in the triangle of conflict. I'm also open for the triangle of person to be updated. Simply put, there can be a conflict between God, oneness, and earth-life behavior. For example, when someone thinks about themselves an isolated entity, this is what I would call a defense against God. The ISTDP metapsychology does not cover this. I'm sure this can lead to a kind of existential anxiety that ISTDP couldn't account for. And my psychedelic experiences have shown me a way to find inner freedom, which I now can use as a guide when trying to help my patients be free in session. My understanding of the ISTDP metapsychology has moved in a more pre-verbal direction. Helping the patients is not so much about what I say, it's more about if I can find a peaceful, free space inside to meet the patient in his freedom. An example of this is that I now can really create quite a lot of pressure just by being emotionally present in silence with my patients. And when I specifically asked about clinically relevant changes, several people reported an increased emphasis on this same calm, intuitive, less verbal therapeutic presence, in contrast to the kind of very active, technical intervening style of ISTDP. And several people also noticed an increased ability to resist counterproductive relationship dynamics that had bothered the therapist previously in the past. Since the retreat, I become more intuitive, more trusting of my somatic countertransference, and more brave in my work. I'm trusting my body and following the physical cues in myself to guide my interventions. Intuitive hits and use interventions based on that. It's working surprisingly well. After the retreat, I had a sense of inner quiet and calm that my patients responded strongly to, as I sensed my inner peace. The UTA, Unconscious Therapeutic Alliance, was stronger, and they seemed to allow themselves to feel their own lives more deeply while in my presence. It's easier to calmly offer closeness, but also to demand closeness, honesty, when you yourself feel more open and honest. I have gained an increased understanding of the meaning of the therapist's warmth, presence, and eye contact in a wordless, undemanding way. I feel that this helps me help the patients reach greater breakthroughs. I dare to sit silence more. One patient had lost their voice the week after the retreat, and we sat silently together for the whole visit. The patient had a breakthrough to sorrow and saw how she constantly takes on responsibility over the other, and how she thus loses contact with her inside. I'm enjoying my work greatly as I don't fear resistance. I am able to hold my worth in therapy sessions and push back on patients when they reject or invalidate me in order to help them see what they are doing. Before, again, I would take this too personally, get anxious, and avoid helping the patient own how they are treating me, aka themselves. So basically, some summaries of these findings were that therapists found that the emphasis on guilt and rage, which is common in ISTDP, isn't enough to account for the phenomena of access to love and need for connection that they found in themselves. There might be some common change processes between ISTDP and psychedelics, like this unconscious therapeutic alliance, inner healing intelligence, alterations of consciousness, and insight into conflicts through strong emotional experience. And yeah. So this was all of one group, so there might be some risk of groupthink and overenthusiasm, and it doesn't really need to represent any meaningful, like actual measurable outcomes. So it's a limitation. So it could be the case that psilocybin, along with psychosocial support, could lead to increases in attachment security and more emotional regulation, but this was not a controlled study, so we would need maybe some RCTs to measure if there's an actual effect. And so therapists really seem to be deeply affected in meaningful ways. So I really think we need more research on the effects of psychedelic use by therapists. And can there be like some permanent improvements perhaps, or is it only enthusiasm in the days and weeks after a powerful retreat? And yeah. And lastly, maybe ISTDP could be one of the therapies that could inform psychedelic therapy practice. And to the last question, I don't know. It's up to you, maybe. Yeah, these are my references. Thank you.
Thank you very much, Gustav, for this fascinating talk. Questions and comments?
Yes, I was wondering, beyond therapeutics, do you see any other professions where you think taking psychedelics could be or should be studied for whether it is useful for it? And bonus points if it's something that's like surprisingly far from high human interaction therapist style jobs.
Probably. I would welcome any studies on that. This is my interest, so that's why I did a study about it. But I'm sure that it could help people in many professions, or maybe at least people in many professions would perceive it as helping. It would be a different story to measure if there are actual like improvements. But people's own experiences of their work is also meaningful. Yeah.
Some studies on religious leaders at least, but maybe that's the only one. I don't know. So far, yeah. Questions, comments?
So of course it's obvious that the therapist needs to be like stable and well-being when they're giving the therapy. But at least in Finland, to be able to get to the psychotherapy training, you need to pay it yourself, and that might therapy trainings because then everyone can't afford it. But would you say that it's possibly important? And did you see in these studies or questionnaires, or I don't know, did you know the therapist, but do you see an importance that therapists have kind of also went through this kind of like a hero's journey, or the like difficulties in life to really understand and like see the people's suffering?
So is your question that if it's important for therapists to have their own hero's journey, or probably yes, but people have all different types of journeys that go into therapy. I don't really have an intuition on that, but probably I would imagine I would prefer to have a therapist that has done lots of work themselves. Yeah.
Right.
Thank you. Thank you for the presentation. I wanted to comment on one of the qualitative quotes that you showed, because I think it illustrates a phenomenon that's very interesting as it comes to training psychedelic therapists. And that's the quote where the patient said, I noticed the theoretical model that I normally use cannot accommodate this experience. And then from what I understood, this therapist came up with their own extension of the theory. And I think that is something, I see that a lot with therapists. And I think it's potentially problematic because people come up with ideas from scratch instead of building on the knowledge that is already there. So I think there is often a reluctance to first of all, really verify that the previous model is actually has to be modified, because sometimes it doesn't have to be, but just one's own understanding of it. And then I think the next step would be, when I understand, because it can be, of course, that a theoretical model is too narrow to account for certain experiences, including psychedelic experiences, that you would normally look for other theories that already exist instead of just coming up with your own stuff. And we see that a lot in the psychedelic field, that people find the experience so extraordinary and so special or sacred or exceptional, yeah, that they seem to drop the willingness to stand on the shoulders of giants, yeah, and instead reinvent the wheel. Just a comment, and perhaps you could comment on that comment of mine.
Yeah, well, thank you for that comment, because I definitely agree with you, and I was a bit, I don't know, embarrassed maybe about some of the results, because I think it's definitely problematic. And just because they have these experiences, as I said, it doesn't mean that they become better therapists just because they have these own insights and ideas. And it could potentially be very problematic. One thing that I found interesting was that several people wanted, from my interpretation, several people wanted to be more like psychedelic therapists in their non-psychedelic therapy. They wanted to use those same like experiences and processes that they themselves experienced and promote them in sober therapy. But I agree. I think people might need to get some information other than their own insights if they want to practice therapy. Yeah.
Hello. Would you talk a bit about what kind of ethical discussion there's been in Sweden regarding psychologists putting up an organization like this and doing the retreats in Amsterdam, where there's no like normal kind of clinical setting, or yeah?
Yeah, it's been not a lot of discussion to my knowledge. There has been some like internal discussion in like psychologist professional organizations, but most of the media reporting has been quite supportive. There hasn't really been a big backlash to this retreat company, which is interesting. It was against, contrary to our expectations, given that Sweden has a reputation for being very, anxious about these things. So far there hasn't been any big therapy or any psychedelic science in Sweden, to my knowledge.
All right. I would ask you to all please remain seated, and thank you, Gustav.